This is a really exciting day for us here at St Andrews because we're opening this new centre. In many ways you see here a waiting room, a reception area, but to us this centre is so much more in that it's a new way of delivering care, it's a new coordinated approach, and hopefully it will deliver fantastic health benefits to the people of Queensland, so very exciting for us. I would also like to publicly recognise and acknowledge that this centre was built with the help of a bequest from the Lingard family, particularly William Lingard, who made this bequest in the memory of his relatives, and you'll see a plaque out there on the counter that we'll be mounting in the centre to acknowledge that.
Today we're here to look at the Pelvic Medicine Centre, and really this is about clinical leadership. Through a dialogue of conversations we had with our gynaecologists and urologists and also some of our surgeons, we decided to put together a model of care which was collaboratively designed, I guess, and integrated, in that given that there was a growing prevalence of disorders related to chronic pelvic conditions and also incontinence that existed in both men and women, we felt that if we brought them all together and built a clinic, a service which was going to link them all together to liaise with general practice and primary care, that we could deliver better clinical outcomes for patients in that regard. And really an exciting day for us at St Andrews, and into the future this will provide significant clinical benefits to the people of Queensland.
Traditionally, gynaecologists, urologists, colorectal surgeons work in the pelvis quite independently. We've developed our own ideas, our own procedures, we have our own literature, we go to our own conferences, but rarely talk to each other. However, in recent times there's been a real shift in paradigm where we now see the pelvis as a single entity with these previously separated compartments acting as a unity. A lot of that's come from our understanding of changing function and structure, and also the chronic pain aspects and the interrelatedness of the various systems. So that developing a centre like this, which is multidisciplinary, collaborative, all in the one site, has to end up with superior patient care and superior outcomes. The sort of problems we'll be dealing with are not esoteric, they're common. And in fact they are embarrassing and unpalatable, with various types of incontinence. They often skim under the radar and are not looked after well in our current forms of care. Recent figures from the Australian Institute of Health and Welfare suggest to us that urinary incontinence is a very significant common clinical problem affecting 37% of Australian women and 13% of Australian men. We're hoping that by having this collaborative interaction between specialists from various areas, we can get better patient outcomes. We look forward to making a difference in men's and women's lives with these complex problems. We look forward to integrating existing therapies in new ways. We look at new medications, and we also look at the new technologies such as sacral nerve stimulation, with the increased applications of those in both men and women. We look forward to sharing our knowledge and reporting this in the literature, because we are a fairly unique group of clinicians. We look forward to teaching and sharing our models of care with the generations of students and doctors coming through. We look forward to doing this in a faith-based healthcare environment that's supported by our administration. We look forward to making a difference in people's lives.
As you all know, that this hospital has had an enormously significant part of the history of Queensland with regards to healthcare in 55 years since its inception, and of course I think its name actually says it all. It's a hospital which continues to be at the cutting edge of innovation with regards to healthcare in the state of Queensland, and I think what we're seeing today with regards to this Pelvic Medicine Centre, once again, it's not only at the cutting edge of multidisciplinary healthcare here in Queensland, but also doing what could be a first in Australia as well. So very, very significant. And I go back a number of years. About 12 years ago, my own father came to this hospital with a very, very serious illness, and because of the very fine interventions, because of the very fine care that he received at this hospital, he received some number of additional years of good quality life. And I want to also thank the staff here for their enormous compassion, care and professionalism at that time, and which is also very much ongoing. At St Andrew's War Memorial Hospital, you continue to be at the cutting edge and providing the health care which is expected by your patients as well. I look at what's been done with regards to pain management, what's been done with regards to celiac care, what has been done with regards to care for people that have various sleep deprivation issues, and a whole range of other areas where you continue to innovate as well. All of these areas together, whether they are urology, gynaecology, colorectal care together in one multidiscipline centre, is extremely important, and it helps us being able to address what is a particular challenge for millions of Australians, and that is incontinence, not to mention the other pain issues and the other issues which are far more curable on a day-to-day basis. So again, my commendation to everyone who's been involved in this, to the 7 multidisciplinary specialists that are here today that are going to be involved in this multidisciplinary centre. I commend you, I congratulate you, also your team and hospital management for what you have done with regards to this amazing innovation. And I certainly look forward as Health Minister in Queensland to see how this continues to develop in the future at the cutting edge, and also what other remarkable innovations that you will continue to come up with at St Andrew's War Memorial Hospital. So ladies and gentlemen, again, thank you very much for the chance to be here, for the invitation to participate in what's a very, very important and significant day in the remarkable history of this hospital. And I think without any further ado, we could declare this centre formally and officially open. Thank you very much.
I think it's now time to unveil the official plaque, so Minister, if you'd like to come this way, he'll be joined by Richard Royle, the Executive Director of UnitingCare Health.
I'll go for it, we'll better make sure we get the right one.
Well done, Lawrence.
This hospital continues to be at the forefront medically, and this is yet another example of it. I'm delighted to see the sort of integration and coordination that's occurring through this centre, which I think is the way of the future. It sees the ability for highly specialised clinicians to work together to treat patients in a more coordinated way, and that has to be a positive. Again, Minister, this is another example of innovation and excellence in the private sector that you quite rightly keep highlighting. And through what we've been doing, UnitingCare Health, I think we punch above our weight. We're training nearly 200 medical students a year through our clinical school between Wesley and St Andrews. We're training about 1,000 nursing students, up to 100 allied health students, and on top of that we do a lot of research through Wesley and St Andrews. Plus this year we'll treat about 110,000 people through our hospitals.